All right, well, I'd like to thank you all for coming this evening. And this is it's a very important topic, and it's one that affects a lot of people here in not just in our county, but certainly a lot of people in our cities and our county. And before we start, I'd like to invite Orange County District Attorney's Office Head Chaplain Lance Emma to give the invocation, sir.
Would you bow your hearts with me? Heavenly Father, we come to you this evening asking for your guidance, for your wisdom, and your help as we begin this meeting. We gather here to do what is good and what is right. We thank you for all those who are gathered here because they care about our communities and the people in it. I ask that you would bless and prosper the work they are doing to care for and protect our communities. I also pray for those who have suffered at the hands of others and ask that you bring comfort and healing to them. May the work done here tonight be blessed by your wisdom and favor, and I would ask for your grace and your favor that the discussions that happen here tonight would go a very long way to ending rehabilitation, exploitation, and healthcare trafficking. Amen.
I didn't properly introduce our chaplain, Lance Emma. He's currently the general manager of KWVE television and 107.9, no, it's radio, and 107.9 FM. He also serves as an assistant pastor at Calvary Chapel in Costa Mesa, as well as the communications director for a nonprofit humanitarian relief organization. Please stand for the flag salute, and I'll ask Councilman Jim Righeimer to assist us in that.
Place your hand on your heart and repeat after me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So before we start our testimony, I'd like to thank the Costa Mesa City Council for so graciously allowing us to use this facility and for this forum. And Mayor Sandy Guinness is going to give a brief welcome. Mayor?
Well, good evening, and thank you for coming to this event. And we'd also like to thank District Attorney Tony Rakakis for coming here to listen to our community and learn about this really important issue affecting our residents. We like to feel that we're a compassionate city, and we know that people who are battling substance abuse problems need help. But at the same time, there needs to be a balance between the peace and tranquility of our neighborhoods and recovery homes. We have been inundated with sober living facilities so much that we have the highest concentration in Orange County, which also has more than its share when you look at the whole state. So basically, Costa Mesa is pretty well buried. This is not only detrimental to our residents, but it creates an institutionalized setting. We have people who say they no longer feel like they live in a residential neighborhood. And also, it's not beneficial to those who are in the sober living homes who are seeking to, there's something going on here with the mic? Oh, wow. Okay, there we go. Should I just go on? I'll just go on. But anyway, it's not even beneficial to the people in the sober living homes because they, instead of being in a regular residential setting, will then be in an institutional setting. And some of the problems that we've encountered in our neighborhoods are people congregating outside of the homes, smoking cigarettes, using profanities, throwing trash over the fence. And there are also issues with parking. Some of the homes, people are not allowed to drive, so it's actually an improvement on the parking situation, but there are others where there's a proliferation of cars. There's one I went to look at where the cars were all parked across the sidewalk. You couldn't use the sidewalk. And to protect both our residents and those who are living in the facilities, we've enacted some fairly strict ordinances to limit the number of homes in an area so we don't have an over-concentration. We've stepped up our code enforcement and our law enforcement officers. And we also have a new web page that provides comprehensive information on some of the homes, which ones have been city approved, which ones are state approved, their application status, group homes cited, operations that have closed, and locations under review. And we currently have 139 citations that have been issued on this particular topic. We're trying to take measures to hold sober living operators responsible for curbing individuals. This is when people are brought to the homes, often from out of state, and then dumped at the curb like a piece of trash. Their stuff is in a trash bag. They're sitting there next to the garbage bag with their possessions sitting on the curb. And it's bad for the people, it's bad for the city because they have no resources, so their only recourse is to either panhandle or steal, hoping they could make contact with somebody to get home, but we also have outreach workers to try to help people get home, but that's another burden on our city. And quite often we find our hands tied because of state and federal regulations, so we're hoping that state and federal officials will help with organizations like the Association of California Cities and the League of California Cities to come up with some solutions. And we thank you for your attendance tonight. We look forward to learning more about what can be done, because we know from the series of articles in the Register that not only are there direct impacts on our community, there are instances of fraud, there's instances of brokering of patients, which is essentially is human trafficking, and it's bad for the residents of both the sober living homes and those who live around them. Thank you.
Thank you, Mayor. And also a little bit, maybe a change in that perspective, I don't know, or a little different perspective for the city is, I think, City Councilman Jim Ringheimer had a few things he wanted to say.
Thank you again, Mr. DA. The bottom line for the city is we are really kind of coming to our wits' ends. We have used every method that we can use, and in some ways it's working, in some ways things are being solved, in other ways there is so much money in this industry with the Obamacare, where people out of state immediately can get insurance, immediately can have $25,000 spent, $30,000 spent on them. And what we're finding is no matter where we go, we're bumping into walls. Up in Sacramento, we've had both Republicans and Democrats. We got Sharon Quirk-Silva up in Fullerton trying to get a bill through. She's killed, her bill gets killed. We've had Matt Harper, our assemblyman down here, try to get a bill through. It doesn't even get out of committee. You got Senator Pat Bates, she's trying. These are normal, simple little bills to say, give some control to the cities. They're totally killed. Finally, in Congress, we had Darrell Issa, who actually talked directly when Jeff Sessions was being brought in as the Attorney General during questioning to look at the item. Darrell Issa is now going to be retiring, not running again. We need someone to come in and look at it, and the district attorney has done so much with the sex trafficking that's happened here with task force and all those kind of things. We just want to reach out to the district attorney. We need to talk to him to tell him what the issues are so that we can see if there's something he can do, because there's a consumer protection issue here with families that are spending their life savings to take care of their kids and it's being wasted. And there's all sorts of issues we think with insurance fraud and all those type of issues. So we're very happy to have you here, and again, we need to our communities to reach out to you to see if there's one more chance to solve this problem, because it's not going the right way. Thank you.
To impart some information about some of the cases and a couple things that we're doing that you probably don't know. I'm going to call a prosecutor in our insurance fraud section, Hope Callahan, And Hope?
Yes.
Yeah. And she's got a few things to say here.
Thank you. My name is Hope Callahan, and I'm currently a prosecutor in our insurance fraud unit. The cases that I prosecute is anyone who bills insurance for fraud, and that involves medically unnecessary services that were never rendered. I currently have a case involving a sober living operator of many homes who turned all their residents into employees in order for them to buy insurance policies for each of the employees, therefore giving them the opportunity to bill for frequent and daily urine drug testing that was never looked at for any medical purpose, was not looked at by the doctor who wrote those unnecessary scripts. Those tests were not used for any medical necessity for the patient, but instead they were used and abused, and when they're no longer covered by insurance, when the insurance companies got wind of it, they stopped paying them, and that's when curbing starts, because those people are no longer moneymakers for the fraudulent operators, and so they want to fill their homes with fresh insurance policies, fresh people, and they are getting them from out of state, they are getting them from AA meetings, they are getting them from anywhere on the street where people can make contact with them. They get a piece of the pie by getting a kickback to get people into their sober living home, their addiction treatment center, or wherever center that they can use to bill insurance. We have several investigations in our office. We're building our unit, and we want a partnership with the community. And thank you very much for coming. We are here, and we are ready to help you as partners to solve this problem. But my focus is insurance fraud, the criminal penal code, and that's where I can help you solve this problem. Thank you very much.
Thank you, Hope. We've been prosecuting insurance fraud, of course, for a number of years, and we have some pretty substantial expertise in that. Hope Callahan being an example, and that particular case, I think, is a pretty good example of what she's doing. It involves several sober living homes, and that's a criminal case we're bringing against those folks, and we'll be working for criminal sanctions for jail time and such in that case. So that's one angle. It's one thing we can do, but it's slow, and it's very resource intensive. So for us to investigate and develop the facts and do all the things necessary to bring a criminal case, like I say, it takes a lot of resources, and it takes a lot of time to get that done. But Hope was talking to me a couple of months ago, and we were talking about that case, and she was discussing some of the other cases that she's looking at, and she's investigating a number of cases, or she's involved in getting investigations done in a number of cases. And so so that's a helpful thing. But when we start looking at what we have, the actual number of cases that are out there, the number of sober living homes that are out there, it seems to be quite a few more. And I mean, I don't know what the numbers are, but when I asked Hope how many were in Costa Mesa, she said 100. So so it's a lot, and it's a big issue. And we have some things that I think we can do. I think we've been pretty effective in this in the human trafficking area. And when we started that a few years ago, I think it's been about 5 years ago, there was a kind of a different view about prosecuting human trafficking. Well, it was really prostitution, and we pretty much concentrated on going after prostitutes, charging them with soliciting to do prostitution, basically. And it was pretty ineffective. I mean, it just wasn't really an effective thing. But what we learned is that most of these ladies are not out there because they want to be. They're out there because they're forced to be. They're basically enslaved. And so we changed up what we were doing. We put a task force on it, and we got involved in with our own unit in the DA's office and the county task force to stop human trafficking and change the outlook in terms of investigations from going after the prostitutes and trying to prosecute them to finding out why they're there, why they've been forced to be there, what's going on, and developing evidence against the pimp slave owner kind of people. And that's been pretty productive because we've convicted about 250 of those guys and put several of them in prison. So I think task forces are pretty helpful because they help us to put more resources on a particular topic. So we've been working on the problem of these dirty sober living homes for a while, and we're referring to it as recovery exploitation because it's people who are in need of recovery are being exploited. So the process that we're seeing is, and I think Hope discussed it a little bit, that people are being recruited or brought to the sober living homes and not actually being treated medically for anything, but they're able to bill insurance under the Affordable Health Care Act. They're able to do billing for mental stress and that sort of thing from the Affordable Health Care Act. So under that they get prescriptions to write to get urine tests, and they're requiring the people to get urine tests on a daily basis, and then they're charging the insurance company for $300, $500, $600 for a urine test, and ultimately billing millions of dollars and defrauding the insurance companies out of a great deal of money, and of course that increases the fees and so on and so forth. But what I'm suggesting though is that I think a task force is something that's going to be helpful in this area, and we might have some different ways to go about it other than just the criminal prosecution. And but before we get to that, I'm going to want to turn the floor over to two people who have been victimized by bad operators, and for obvious reasons they'd like us to respect their privacy, and we're going to do that. But I wanted to thank them for coming and commend their bravery for speaking out about what they've experienced. And so Alan and April, if you're here, yes, please step forward.
Thanks. My name's Alan. I may not be the type of person you'd choose to view as being a victim, and I really don't want to call myself a victim other than I've witnessed some bad practices that have affected me, and I can only imagine what others go through. I resigned from a job with Employee Assistance Program, and I have my own insurance. I had company paid insurance in order to get myself better at going to traditional group meetings and pay for services out of my own pocket. And what's happened is over the course of that it's been complicated a little bit by the fact I've had my laptop stolen. It was later returned, but it's the same people involved. So they have access to all of my email accounts, my social media. They monitor me. They monitor my phone. They've contacted childhood friends, ex-employers, and family members that I haven't spoken to in some cases over 20 years in order to let them know that they are looking out for me, and have painted me as somebody who they need to be fearful of. When I did go and to see a psychologist to go try to get some help and maybe deal with some of the anxiety, I noticed that I was being tracked and monitored. So that sort of like undermined the whole concept of going to that person. It's complicated, and I don't know what the answer is. This is just some of what's happened to me. I was offered a scholarship. I didn't know what it meant at the time. I do now. It means that somebody gets to bill somebody else for mental help that I'm supposed to get. It's all tied into somebody labeling me as being okay. I feel okay, just not all the time when I'm with others. Although I do view this as part of my giving back, is to be honest and open with people and still go back and see what I can do to help others. Because when I do go to the meetings, there are people dying regularly. I wasn't expecting to see that. I went to a meeting about 11 months ago in a living room with a fellow that was hosting it himself. 10 days later, he was dead. A meeting I went to last Friday, we mourned the loss of a young fellow who's 22 years old. That's happening here. It's complicated. People are trying to help. I appreciate the intentions somewhere behind the people trying to help me. They're somewhat misguided, and I don't know if the solution is simple. Thanks.
My name is April, and I am a victim of healthcare trafficking. I was sent out here from Virginia in July of last year, and I went through the numerous, stages of treatment and everything. And they offered me a scholarship. They bought me a plane ticket to California. They Ubered me to the airport. They Ubered me to the treatment center when I got to California. The only thing I had to do was call and check in with them every day to let them know I still wanted help. And I ended up in California about 3 weeks after that. I went through all the phases. I went to detox, and then I went to the next level of care, which is RTC, which is residential treatment care. And to make a long story short, I finished treatment in October, and I'm still here. I'm stuck. They bought me a plane ticket to get me here, but they don't want to help me get home. My kids, my family, my parents, they're all in Virginia. I went through the treatment center that I went through, and since I couldn't get home, I was offered to go into sober living with that same company, but just, less care. And on February the 5th, they told everybody that was living there that we had until February 28th to get out because they were closing down the sober living facility. Essentially, I was put on the streets. I became homeless. I have since found another sober living that I am, living in now, and I'm working. I got a job, and I was able to buy my own plane ticket to get back home. I will be going back to my family and my kids in May. Well, thank you very much.
So, where's Is this our list of people here? What? Well, I know that. Okay. So, I mean, I think that gives us some perspective here, and April, I think it's terrific that you're able to, you're doing some work and you're able to get a plane ticket back home. But how many others? And so many of the people in the sober living homes are victims. I mean, we tend to just see it as a situation where where we've got these homes and there's too many people there, and it's not good for the neighborhood, and it's not. But that large group of people is being victimized too. I'm going to call Nancy Clark to give us some perspective here, and Nancy is a wonderful lady that I've known for 40 years. And before I was elected as district attorney, and she's been working working with people who are addicted and in need of help here in Orange County for all of these years. And I think she has some information to share with us. Nancy, could you step forward?
Good evening, everyone. I've been sitting here trying to figure out what perspective I wanted to bring to this discussion. And a couple of things. I opened my recovery center in 1990, and since that time, we have tried to be a good neighbor and a good member of the community, because that's the modeling that we want to teach the people who live in our facility. We want them to be a part of the community. We want them to be successful, employed. We want them to give back of their own time. That's the model that we have. Our philosophy is that we don't want people flying out here to be in recovery out here and then not live here, not have them be part of our community. So we don't take people from out of state. It's my belief that people need to be where they have the support of their family, their home, to get sober and successful there. That's my belief. I still believe that. I really didn't know what this human trafficking issue was all about. I had heard about it, but I really didn't understand it. And then I started getting phone calls from people wanting to know how much my referral fee was. And I really didn't know what that meant, but the people calling wanting to know what my referral fee was were people that I had known from this program who may or may not be sober. And I'm okay, so you want to know how much I'm going to pay you to refer me a client. Why would I do that? And so in a month, I had maybe, 20, 30 people calling me up wanting to know how much my referral fee was. And I'm kind of not thinking about that. I've never had a referral process before. People find me because they talk to somebody who talks to somebody else, and then they call me. So then I get a phone call from a facility that is closing, and they wondered if I had any available beds because they wanted to place some of their residents in another program. Sure, I have beds available. Can you send me over a profile of the clients that you want to place? They never did that. The next thing I know, there's a knock on my door, and there's a young lady from that program. She's from Kentucky, and she wondered if I had a bed available for her. She had insurance, and I said, well, come on in, let's talk about it. She seemed very nice. We had started taking insurance, so we ran her insurance, and her insurance was all good. And the more we spoke, she had no money. She didn't know who bought her plane ticket. She didn't know who purchased her insurance, and she needed medication, and she didn't have any money for her medication. So now I'm really concerned. Now she has no money, no medication, We reran her insurance, and now she doesn't even have insurance. So I called these people back, and I said, if you don't buy her a plane ticket home tomorrow, I'm calling the police. I'm going to file charges against you. Miraculously, she got a plane ticket. So I am thrilled to have this getting the attention of the district attorney's office, because I think that this is going to be a big effort that we all need to be involved in. Katrina Foley took a number of us up to Sacramento trying to get a bill passed. We had the mayors of, we had Al Murray from Tustin, Barbara Del Glaze from Huntington Beach, we had Dave Harrington from Aliso Viejo, we had the mayor of Dana Point, the mayor of Laguna, and we all went up to Sacramento trying to get a bill passed that would bring a representative from the state licensing bureau down here. I'm a state licensed facility, and I see a representative from Sacramento every 2 years, whether I need it or not. He comes. It's like, what can you do if you only see a facility every 2 years? How can you possibly know what's going on? So anyhow, we're up in Sacramento testifying, and we are shut down because the agency that sends the people down here from Sacramento, their response was they didn't have enough complaints to warrant having somebody here in our area. You don't have enough complaints? Could that be because people are living under bushes in parks, homeless, and they don't even know how to get to you? I mean, I don't know if any of you have tried calling Sacramento lately, but it's this, it's like calling the auto club. It's like this endless thing of, if you want to talk to so-and-so, press 1 or 9 or 2 or 3, and you never get to really where you want to get to. So I can't even find my representative in Sacramento. How is anybody else going to? So my recommendation is we need to lobby Sacramento. We need to not let up. I mean, Katrina was on the right course when she organized this group to go to Sacramento. We just can't stop there. I was shocked. When I opened my recovery center in 1990, I opened it because there weren't enough places for people to go to get sober and to get help. That's why I opened it. I didn't have any burning desire to open a recovery out program, and maybe I'm not a very good businesswoman, but I wouldn't call it lucrative the way I do it. You know, I finally got a new car, and I finally have air conditioning in my car. It's like, you know, I just, what I'm seeing, and I mean no disrespect to the providers who are here in this room, but what I'm seeing is a lot of people who used to be addicted to dope are now addicted to money. And they have come upon a business plan that is incredibly profitable for them. And the insurance companies are just as at fault because they aren't keeping an eye on things either. Their response is to just not pay people. You know, the California policies that we take every once in a while have been paying us nothing. California Blue Shield, Blue Cross, pays practically nothing. Maybe $50 here or there, and then you get a letter and they want a refund. I talked to a dad yesterday. He has a policy out of Illinois. It paid a program $180,000 for 90 days of treatment. And his son has been to 9 programs in 9 different states. He's only 22. So it's bad. To the providers in this room, I say, you need to step up your game. You need to stop feeling like everybody here in the room is your enemy, and you really need to shape up. I see people in this room who are not good neighbors, and they don't care about their neighborhood, and they have severely impacted their neighborhood, and that's not right. It's just not right. Greed is behind this from the landlord point of view. You know, the business model that a friend of mine utilized, he went to Airbnb, and he found a bunch of really nice Airbnbs with a view of the water in Huntington Beach. And the guy was renting these beautiful homes furnished for $2,000 a week. So he says, tell you what, I'll pay you $10,000 a month. Landlord says, done. So we had 3 treatment programs right in a row that used to be Airbnbs. The landlord's thrilled because he doesn't have people coming and going all the time. And everything was going fine until all of a sudden insurance companies weren't paying the way that they used to. They weren't getting referrals the way that they used to, because now there are so many programs, it's like people get referred to the highest bidder. It's human trafficking at its worst. You're taking advantage of people's pain and fear. I mean, there should be some serious karma to bear here. So, you know, I am happy to take any questions if anybody has any questions. I am sad that after being in this business all these years that I have to be embarrassed about what I do for a living. That I have to be sad that my profession has been smudged by so many people who, in my opinion, are just not motivated by right ideals. You know, we're here to help people. That's what we're here to do. And there's a way to help people and earn a living. But what I'm seeing is just not right. And I think following Katrina's lead and approaching Sacramento and making that phone call and calling them, when they said they hadn't received enough complaints, I thought that was the biggest bunch of baloney I'd ever heard. And they sat right there in front of us and said, no, we just don't think you have a problem down there. Really? Then you need to come down here and live. It's like I was talking to somebody yesterday who said they had a neighbor who moved because they had young children and they didn't want to live next door to people chain smoking cigarettes and swearing with small children. Well, who would? That's not right. People make fun of me because I make all my boys be clean shaven every morning by 9 o'clock. They think I'm an old fart. I am an old fart. I get to be that, and I don't care. My boys are going to be clean shaven every morning. I have a young kid right now, very unhappy, 19. I made him lose his identity because he had to shave. And so it goes. You know, it's just, we have a dress code. People follow it. My people do community service. They behave themselves. You know, they're not perfect. Some of my boys got pulled over the other night. They were leaving one of my classes. And we had 4 people in a car, looked a little suspicious. Police pulled them over, found out they were on probation, stopped on the curb, took off their shoes, I'm coming from Nancy Clark's place. Oh, you know, but they had nothing to be afraid of. Search my car, search me, I'm good. I'm doing the right thing. You do the right thing for the right reasons, it's always going to turn out right. But we should be in this together. We shouldn't be divided. And recovery programs are meant to be part of the community. They're meant to be inclusive. They're meant to be a good thing. They're not meant to be creating enemies and to pit people against one another. But there's something wrong when you're living next to somebody who doesn't respect you. I don't think anybody wants to have that experience. I've lived next to bad neighbors before. It's not fun. It's not fun at all, especially when it's your home. That's about all I have. Anybody have any questions for me? Yes. Hi, Wendy.
Nancy, we're gonna
Oh, no questions.
we're gonna go to questions later.
Okay, I'm sorry.
There are questions, but I'd like to do that later when we finish the program. Otherwise, we'll do. Thank you. And now we're going to hear from 3 people who have lived next to some of these operators. And that's, is it Beth, Denise Iger, Warren Hasselman? Are you all here? Sorry. Step forward.
Hi, my name is Beth. I live in San Juan Capistrano. I'm a homeowner and mother of 3 children. I work in healthcare as an advocate focused on prevention of medical error, safety, and transparency of patient care. We have enjoyed our home living in this neighborhood for 3 years, and we love our neighborhood. It's a quiet community filled with families and caring neighbors. In the fall of 2017, the house immediately next door to me was leased by a recovery treatment business and converted into a multiple adult group recovery residence, commonly called a group home or a sober living home. The residence next door to me is unlicensed, and it is my understanding that such an unlicensed residence can only accommodate 6 residents in San Juan Capistrano. However, the home next to me has 12 beds, which are clearly marketed on their website. Our observations of our neighbors coming and going and our discussion with the site manager confirmed that there are usually 12 people residing at the site. Every night when they get home from therapy, our neighbors have a big pool party and they flood our home with foul language. I have a 16-year-old and a 12-year-old and a 10-year-old. These are stories that are very inappropriate for my children to hear. My boys cannot play basketball or play outside because of the behavior next door. And I can't tell you how many times my boys have come in to tell me, "The neighbors are using the F-bomb again, Mom," or "The party's really kicking tonight." Our neighborhood is not zoned for businesses, nor does it allow any short-term rentals, and it has very clear CC&Rs to maintain a quiet neighborhood. Our quiet neighborhood has become deeply changed by a loud, smoke-filled party house next door with up to 12 residents. We cannot open our windows on one entire side of our home because the smoke is constant. To our family, cigarette smoking is not just a nuisance matter, it is a matter of true health. My youngest child is very medically complex and a special needs child with a condition similar to cystic fibrosis. I have spent much of my life trying to care for his health and well-being and give him the best and longest chance at life that I can. His respiratory condition is very severe. He's fed by feeding tubes, and he has endured 41 surgeries in his short 10-year-old life, including spinal, open heart, major intestinal, and respiratory surgery. And while I understand that the residents next door also qualify as individuals with a disability under state law, so does my son, and I find it disheartening that their disabled rights have trumped my son's disabled rights as a disabled person to have a safe and healthy place to reside, to breathe, and to live. In addition to the excess smoking, the tenants in the recovery business are disposing of debris on my property, drug debris. I brought an example of the OxyContin that comes over and I found in my dog's mouth multiple times. This is unacceptable to find in my backyard and have to pull out of my dog's mouth. This is not something I want my children to be exposed to as neighbors. It's affecting my family's health and safety and my comfort in letting the kids play in the yard by themselves. In addition to lacking licensure, the residents in the house next door to me are receiving treatment, therapy, and medical testing services at a licensed treatment center in town that is owned and operated by the same business that leases the residence next to me. The recovery residence next door is intricately linked to, staffed by, and paid for in part by the recovery treatment business and baked into their pricing and billing for their insurance recovery. On the website for the company and through our inquiry, the staff page confirms that all the group residence managers are employed by the Recovery Treatment Center. The home is leased by the owners of the treatment center as part of their business, and residents are transported in vans to their day treatment by vans coordinated and paid for by the treatment business. All of the residents in the home are exclusively patients of the treatment company, implying a captive business relationship. On their website, the home next to me is referred to as the recovery business's facility and part of its detox and residential stabilization phase. Having numerous problems with the business next door to us, I would often go and knock on the door to ask them to stop swearing or move the smoking and partying. No one, not even the employed residence managers, would answer the door. After many attempts, We then finally found the owner of the business and operator of the business, and we went to talk to them about this. They shared that it is their company policy not to answer the door. They gave us company names and numbers of their treatment business to call when we had concerns with any of their tenants. I don't understand why, if the recovery residence is an integrated, staffed, and financially supported element of the treatment center business and billing, it is exempt from business oversight, licensing, and monitoring. That doesn't seem right to me. I believe that the residents of the recovery home next door to me are being preyed upon by their treatment company. Residency in this home is linked to the recovery business's ability to provide bill insurance, Medicaid, and secure funding. In this way, disabled persons are made homeless when the insurer or other funding for treatment dries up. As the district attorney, thank you for your ability to investigate for this billing fraud, the housing and transport services, and the predatory practices. But you can only investigate if you know where these homes are. Mine, the one next door to me, isn't licensed. It doesn't exist. They don't have to be licensed, so they can evade oversight. I work in my job as a patient advocate in healthcare, and I'm deeply familiar with and sensitive to the addiction crisis in our country, with 115 people dying every day from overdoses and many more becoming addicted. This is a complex public health crisis, and one that many businesses are seeking to exploit, putting vulnerable people at risk. I believe that thoughtful recovery programs are part of the solution, but unregulated, unsupervised party programs like the one next door to me are not a thoughtful solution to this problem. These unsafe residents put patients at great risk. They don't offer supportive and thoughtful supervised healing. It's time to create a better plan to support the programs that are willing to be accountable and identify themselves for patient safety and community safety, and close or penalize the non-transparent and unaccountable recovery operators. I would like to emphasize that as a patient advocate, that other disabled people in group living situations in California face clear governmental rules, licensure, and oversight to protect a vulnerable population. Yet this vulnerable population in recovery from addiction are left unprotected in a residence with no business licensure or oversight. There's no way to track the complaints that I make because they're not licensed and no one's tracking the complaints. There's no way to track if you're putting a loved one in this residence, if that residence has had any deaths, any overdose needing medical attention, or concerns and complaints by the former residents. From my experience, the recovery residence next door that's being operated in neither a safe nor proper fiduciary manner to help those individuals. If I were a parent putting my adult child in this facility, I would never know how little it will help them and how dangerous it could be. Unless we have transparency into the rents they're billing clients, the amounts charged for sobriety testing, the efficacy of patient outcomes such as length of stay, relapse rate, overdose events per year, morbidity, how can anyone leave a loved one in an unlicensed recovery residence and be assured that they're being safely managed in a vulnerable state? The recovery residence next door to me is not a good neighbor. It's not safe for its residents. It's a circus of transitory care that is an integral, unaccounted for part of a business operation. It's a health risk for my family and especially my son. This is a business that pretends to protect and care for a vulnerable group of people without transparency and accountability. These residents need help and support, but not in the way of pool parties, active drug use, and overfilled group housing. All other areas of patient care require licensure and transparency of outcomes. Why shouldn't care for recovering addicts be held to that same standard? Why should my family be kept unsafe because of lacking oversight? My family and my disabled son is suffering from the party boarding house next to us. Better accountability protects all of us, those who place their loved ones in these homes and those who have to live next door to them. Please create proper oversight of the unlicensed, unaccountable, and unsafe recovery businesses. We need oversight for both the patients who live there and families like mine that live next door. Thank you.
Denise and Warren.
Hi, my name is Denise Iger. I'm with the law firm of Iger, Walko, and Bonkowski. I'm a lawyer. I've been representing homeowners associations exclusively for the last 22 years. If you asked me maybe 10 years ago what a recovery home was or sober living home was, I'm not sure that I would be able to give you a good answer. I might have to go back and research the one client that had told me something about what was going on in their situation. It certainly wasn't a common event. If you ask me now, I'll tell you I feel like I'm an expert on this. I'm constantly being asked to speak on this issue, and additionally, I'm getting calls very frequently from my homeowners association clients. The calls are all about what can we do about this, but the complaints are all pretty similar. I want to run down some of the more common complaints that I'm hearing because there's a commonality amongst these homeowners associations. People are living in garages. The houses are housing 12, 15, 18 adults at a time, regardless of the number of bedrooms in these homes. Probably one of the more concerning complaints that I hear, the one that gets people very emotional, is that people are wandering the streets to get away from the overcrowded home. They're smoking in the streets, they're having loud phone conversations in the streets because this is the only place they can get privacy to have these phone conversations. They're sitting in front of other people's homes while they're doing this. Again, a recurring theme is that they're smoking cigarettes. They're smoking cigarettes while they're having conversations walking up and down the street. They're smoking cigarettes in front of the homes. They're smoking cigarettes in the backs of the homes. The cigarette butts are found in the streets, the parks, the playgrounds, the green belts. The late night gatherings are of great concern. They're in the backyards. Neighbors can't sleep. They're very frequently, the late night gatherings are happening on weekdays. 10 to 20 people can frequent these late night parties chain smoking, and it's just an incredible inundation of smoke. Needles and spoons are being used to make drugs, and they're found in the surrounding areas. Petty theft increases. And of course, this isn't the case for all of these recovery homes, but again, it's a recurring theme that we hear. Bikes and tools go missing. Cars are broken into. There's phishing, where people will go and try to open up the cars and try to find the ones that are unlocked so they can take whatever they can grab to feed an addiction. Streets are packed with cars from the occupants as well as their guests. Again, there's a privacy issue when you overcrowd the homes, and so you see people spending time in these cars too. If you want to have an argument with your girlfriend, you're not going to have it in the home that's filled with 15 men. You're going to go out to the car, and you're going to be screaming and yelling in that car, smoking your cigarettes, potentially doing other things in those cars too, and it causes great alarm for people to see people in cars outside of their homes. An oddity that I wasn't expecting to hear, but it's a common theme, is that there's shuttle buses and vans pulling up every morning in front of these homes, and frequently the cars are left to idle. So we get complaints about gas fumes going into other people's homes every morning. The noise complaints start up with people being loaded into the vans, and they're screaming and hollering to the people who are back in the home, saying, hurry up, and they're smoking as they wait for their friends to come out of the home. Trash piles up. Mattresses line the exteriors of the homes. For homes that are supposed to be recovery homes, where they're sober living homes, apparently what's happening is that a lot of people are going directly into them instead of going to rehab first, and so oftentimes this is their first day in sobriety. So we do hear frequent complaints about what goes on during the detox process, people hearing other people retching all night long as they're coming down. Rarely, but in cases where this does come up, it's a very serious problem, is the facilities get overburdened. We occasionally see very close, densely populated condominium associations that will have one facility pool for, let's say, 50 or 75 homes, and you have 8 grown men move into a condominium in that association, And in their free time, particularly if they're from out of state and don't have other resources, they might use that pool facility or the gym, and that's going to be an overburdening of those resources. So I'd like to tell you that these reports are exaggerated. And I will tell you that when I first started hearing them, I thought that maybe this was a situation of tall tales and that maybe these people were truly just intolerant and unsympathetic to the plight. But my husband and I, about 6 years ago, decided to move to the beach to raise our future family. And part of the reason why we wanted to do that, it was because of the climate. We wanted to keep our windows open all of the time, smell the waves, get the cool air coming through all of that. We had a sober living home move into our neighborhood, so I can tell you from firsthand experience that did crush our dreams. As soon as they moved in, and I mean the day after, we had to close every single window in the house because of the smoke and because of the noise. And when I was going to go to trial the next day, I didn't want to be kept up all night by the partying. When I had been nursing a baby all night and I wanted to get an hour of sleep, it was a little disturbing to find that I couldn't do that because of the noise complaints. I did want to, I don't know how to control the PowerPoint, but maybe if somebody could. I did want to share some pictures of what we were going through. Last year, we were on a family walk. I live on a street with 4 homes, and it's a dead end, and I know all of my neighbors really, really well. My 3-year-old went to go pick up these spoons on our street. So in case some of you aren't familiar with what this is evidence that somebody was cooking and shooting up on my street in the middle of the night. Very, very disturbing thing to find. If you could forward on the next one. This is a picture of the sober living home that was in my neighborhood. Again, this is a common feature where you see these mattresses being lined up. And in this picture, you can see this garage was being used to house multiple people, and you can see that there's a demising wall in the garage too, which is a fire issue for the people living in that home and in the garage. But what we did learn about this particular operator is that it wasn't sufficient to have those beds in the home. There was people that they could sublet beds to, other providers, and so this is how you create more beds when you've run out of space in the home itself. When this was going on, we were contacting the police quite frequently. It is not fun to contact the police at 11:30, 12 o'clock at night and hope for some kind of immediate solution. It can't happen. The police are doing other things. They're overtaxed. This is a noise complaint. And it's not a magic wand that makes the noise stop. If I really wanted to get serious about it, I was very much aware of the law. I needed to wait for the police officer to show up at my home so that I could make the formal report. I don't want to stay up in the middle of the night to do that. That wasn't a good solution for me. We did reach out to the provider, and he was very kind in saying, call me directly, I will take care of it. And I will tell you that every time I called, he was able to place a call over to the home, and the noise did stop about 10 minutes later. But I also found out that every time I was making those calls directly to him, I was really cutting the code enforcement and the police and everyone else out of that system that was going on of communication. And in doing that, it was harmful. It was harmful because people didn't understand what was going on. It was also harmful because it wasn't changing anything. If I have to keep calling this person over and over again to get the noise to stop, there's no incentive whatsoever for the noise to stop permanently. It doesn't change the fact that I'm still being kept up overnight. I'm hoping that some form of supervision or regulation can be put in place. I am very much aware that there are good providers. I will tell you that I never once have heard a complaint from a client about a home that was not through a professional provider, a professional operator, where people had just come together to live communally to try to get better. And I sincerely hope that those folks get better, and I sincerely hope that there are good operators who are being very respectful neighbors and that there is some recourse. I am not unaffected by the addiction process. I have family and friends who have needs for these kinds of things, so I'm certainly not unsympathetic to the process. But the way the current system is working, it does feel that there is an abuse, and the abuse is because of opportunity, and that opportunity needs to be eliminated. Thank you.
As the slide says, I'm Warren Hanselman, and I've lived in the same house on what had been a very quiet street in San Juan Capistrano for over 40 years. Before I get into specifics, I'd like to give you some idea of what the situation is that I'm going to talk about. As of the fall of 2015, we had 2 recovery residences handling detox patients located across the street from each other. The impact on our neighborhood was immediate and dramatic. Over the course of many months, we sought relief from the city and sheriff's office, but to no avail. During this period, I elected to collect some data and visual information that might help demonstrate some of the impact. Like the previous speakers, I mean, it's the same litany of complaints. We have excessive noise, partying, smoking, foul language, and verbal harassment of female neighbors. Other issues include drug paraphernalia being thrown over the fence and whiskey bottles in the street. A police incident that at one of the facilities had the officers responding tell the neighbors to stay in their house as the officers approached the facility with guns drawn. Due to the nature of these businesses, there have been many emergency vehicles visiting, sometimes blocking or severely impacting the ingress and egress from the neighborhood. Again, due to the nature of these businesses, there has been a significant increase in traffic flow, parking issues, and parking violations. The following findings that I'm going to show are the result of my observations collected on a random basis. So this is not a scientific study. I haven't gone out there with monitors and monitored all this. Over the equivalent of 40 business week period, I've noted at least a third of the time there were 12 or more vehicles parked at these 2 facilities. The count peaked as high as 16, which with multiple trips in and out is probably at least 30 trips, car visits a day. 22 parking violations with at least 1 vehicle over the sidewalk and or blocking the fire hydrant. While none of these are major crimes, the net impact has been the family with the toddler has had enough and moved out several months ago. Another recovery facility has moved in. We now have 3 in our neighborhood. Our residential street is being turned into a business district with all the attendant issues. Talking with a friend in town in the nearby neighborhood, they've had many of the same issues, that's over and over again, but especially with loud and very violent disagreements. What is most dramatic here are the number of emergency responder visits. This facility has had 27 over the last 24 months, 4 in the last 3 weeks. While this is impactful on the neighbor, pity the poor people living in that facility. It's much more personal and frequently much more tragic for them. And nothing can be done. We have filed complaints with the state, we've called the city, nothing has been done. Stepping back, we looked a little deeper at what was going on in San Juan Capistrano to see if we can get any patterns to this. In so doing, need to recognize that these are just the complaints that specifically reference a sober living home in the blotter report. Not all reports, excuse me, not all the complaints about these facilities that go to the sheriff, and that many of the complaints logged are involved with recovery residents don't reference it in the complaint. With that in mind, we see some serious reports, such as sexual predators and gun concerns. Issues that don't normally come to mind when you think of neighborhood complaints are people coming and going from these facilities, walking or driving while under the influence. The biggest group would be under the miscellaneous, the catch-all. These complaints run from the serious, subject in the house is threatening to shoot himself, or the subject's having a psychotic episode and fighting with a fellow patient. Another complaint in that log, it was, well, a little bit tragic or disruptive anyway, I should say, for the neighbor next door, does contain a bit of irony. Subject in the driveway is screaming at the informant. There's no golf course, pool, or ocean view. So it's a potpourri, let me put it that way. Now, we all have to ask ourselves, why has the press been coming out in Orange County, but with so little coverage elsewhere in the state? And we see that when we go to Sacramento as well. Why don't the other people care? We here in Orange County are bearing the brunt of the impact. With only 8% of the state's population, we have 44% of the recovery residences located in our neighborhoods. Let me give you another number. We have 245 licensed facilities living in our neighborhoods. And from the discussions across city lines and what we've been able to piece together in San Juan Capistrano, there are at least 4 of what have been described as the unlicensed homes in addition. That's 1,000 facilities sited in neighborhoods, not in business districts, in Orange County. Further analysis shows it's even worse in our coastal communities. What this slide shows is density based on state average. So the state average is 1.4 homes per 100,000. This is what it looks like. We've got 9 of the 11 most impacted cities in the state. The only place that's worse is Port Malibu, with 220 times the state average. Now, the oxymoron there is it's hard to put poor with Malibu together, but I think you get the picture. But if you look, 50 to 60 times the state average in our communities is pretty common through Orange County. To give you another example of how extreme this is, I have about 50 residents total. I mean, that's kids, adults, dogs living on my street. We have 2 of these facilities. Sacramento and San Francisco, with over 1 million, have the same number. That's how much we're getting impacted here in Orange County. And the scary thing is it's only getting worse. The growing pressure for more facilities and the billions of dollars the federal government is pledging for this effort will certainly add to our numbers. So what can we conclude from all this? There's a very marked impact on our communities by these residential businesses. And I consciously use that word. These are businesses. They are not homes, as the industry would like us to have them called. They are certainly not families as defined by the state and the code that calls out for these facilities. And in many cases, our residential streets are being turned into business zones. It isn't just the few, the 8 or 9 here. I've gone through the state licensed facilities, and there are 13 cities, most of which are in Orange County, that have at least 3 facilities, licensed facilities, on one street. The impact, while noticeably lowering the quality of our life in our neighborhoods, does not lend itself to residents reporting major crimes, felonies, or mistreatment. The reason for this is those that happen are behind closed doors. The problem is being felt to the extreme in Orange County and getting worse. We need legislation and/or updated laws to deal with this new reality. And we need more help from law enforcement through beefed-up investigation and aggressive prosecution to bring some order to this industry. So thank you for having this hearing tonight. Awareness for the problem is only the beginning. It's up to the rest of us now to raise our voices and bring about some sanity as to how our communities plus state and federal governments can deal with this growing and largely unregulated industry. I left the control behind.
Thank you so much. We're gonna hear from Amy Dunkel now. She's the founder and executive director of the Solis Foundation of Orange County, a nonprofit that provides community members with overdose recognition and response training and naloxone, a life-saving overdose reversal antidote. Amy started the Solis Foundation in 2015, 3 years after her own son Ben died of a heroin overdose when he was 20 years old. Amy?
Good evening. My name is Amy Dunkel. I lost my 20-year-old son to an opioid overdose 5 years ago. Ben's first exposure to opioids was at the age of 13. He fell from his skateboard, breaking his arm, and was prescribed Vicodin. Further accidents occurred, more prescriptions, and by the age of 19, Ben was dependent on pain pills. When he could no longer afford to buy the pain pills, he transitioned to heroin. He started smoking heroin. In June 2012, Ben entered his first inpatient rehab. Transferred from a psychiatric ward, struggling with depression, filled with self-loathing, hating the fact that he was addicted to heroin, he walked into the facility in an incredibly fragile state of emotional health. Within 2 days, while in the clinical detox, he transitioned to IV drug use. Next, Ben entered his first sober living home in South Orange County. 5 days later, we couldn't get a hold of Ben. My husband drove to the facility, and as he walked through the front door, he heard a deep snoring sound coming from Ben's room. It was 3 o'clock in the afternoon. Our son was overdosing on pills given to him by another client. They were methadone pills, and Ben was slowly dying. His oxygen levels were dangerously low by the time he reached the ER. The sober living manager had failed to recognize the signs and symptoms of an overdose. In August 2012, Ben entered what would be his last inpatient program. After 54 days of an abstinence-based treatment program, he walked out of the facility with a group of other young men. He relapsed on heroin and overdosed. He spent the last 8 days of his life on life support. In 2015, I established a non-profit, the Solace Foundation, and a naloxone distribution program. I realized that the system for treating opioid use disorders was flawed. We did everything we could to save Ben, and he died. I knew I could make treatment facilities and sober living homes a little safer by training staff and clients how to recognize and respond to an opioid overdose using naloxone. Many lives have been saved because of Ben. In February 2016, I partnered with the Orange County Needle Exchange and started to train people in active drug use. Although the Needle Exchange has now been forced to shut, I continue to train at the Civic Center each Saturday, and before the riverbed was cleared, I would train along the riverbed. Through this work, I get to meet many people who have been through treatment facilities in Orange County. Some were actually in treatment with Ben. I meet staff members I trained at these facilities, and through these interactions, I've learned a great deal about what goes on in these treatment facilities. I've spoken to clients that have been offered $5,000 to bring in patients from out of state. Clients being offered $1,000 payments to go to have a medical procedure to implant naltrexone pellets into their bodies. And they're offered more money if they refer more clients. Clients being given cash payments to walk out of treatment facilities once the insurance deductible has been met. They walk out of the facilities, they're actually paid to relapse, and some of them die before they reach the next facility. This practice is killing people. In 2016, according to statistics from the CDC, we lost 336 Orange County residents to opioid overdoses. Most of these deaths occurring in the coastal communities. The oversight of licensed treatment facilities throughout California is handled by the Department of Healthcare Services. Their offices are based in Sacramento. They have a total of 16 inspectors to handle all consumer complaints. Why are they not getting complaints? The treatment facilities are the ones who are supposed to notify this department if there is a death at the facility, if there is an unusual event. They're not finding any reports because the treatment centers are not reporting. And then sober living homes, totally unregulated. The fact that sober living homes are unregulated means that many licensed treatment facilities use them to house their clients. If someone dies in a sober living home, there are no reporting requirements to the Department of Healthcare Services. It's really important to remember that a substance use disorder is an illness, a chronic, recurring disorder of brain structure and function. In 2016, we lost 64,000 Americans. That's 175 people every single day to an overdose. Working in the trenches as I do, I hear firsthand the devastation that opioids are causing throughout Orange County. Over the last few months, we have seen a sharp rise in fentanyl-related incidents. 3 weeks ago, a 24-year-old man collapsed by my table at Civic Centre. He was blue by the time I got to him. It took 2 shots of Narcan and rescue breathing to bring him back to life. Fentanyl is 50 times more stronger than heroin. It's extremely fast-acting and deadly. There were over 20,000 fentanyl deaths in 2016 in this country. All in all, it's a desperate situation and it's getting worse. We have to make evidence-based treatments more available. The gold standard of care for opioid use disorders is medication-assisted treatment. Medications such as buprenorphine and methadone in combination with psychological and behavioral care. The vast majority of facilities in Orange County offer abstinence-based programs. For opioid use disorders, this model results in extremely high relapse rates. With the purity of substances available on the street today, these relapses result in death. At best, it's a revolving door that feeds $1 billion industry. We need far greater oversight of treatment facilities. There should be a regulatory body here in Orange County. Sober living homes must be regulated. When a death occurs in such a facility, it should be reported. Every facility should be mandated to carry naloxone. Every client leaving such a program should be given naloxone as part of their discharge protocol. We're in the midst of a public health crisis. It started with pain pills, then we had a heroin epidemic, and now we're in the midst of a fentanyl epidemic. And yes, there are people, far too many people, who are profiteering on the suffering of our most vulnerable. Thank you.
Thank you for that, Amy. You know, on that particular issue, all of this is so interrelated, and the problem gets to be so complex and huge. It's daunting. But just to let you know, about 4 years ago, my office filed a case against 5 pharmaceutical companies for pushing all of these opioids, and I mean the problem is just huge. But it's been quite a journey since we filed that case, because I was the first district attorney, and this was the first district attorney's office in the nation to file such a case against these companies. But when we file that and start litigating, and the whole idea here is to bring these people, you know, these companies are pushing drugs basically, and they've been marketing these opioids to doctors for things that they're not really meant to do. So the opioids are meant for primarily authorized by the FDA to treat severe acute pain, the kind of pain that where somebody's dying of cancer maybe would be given, should have, and that's great. But they've marketed that to doctors for chronic pain, and so what happens is when people use it over time, they become addicted, and then they can't get away from it, and then they become addicted to heroin or other narcotic substances. And here we are with all of these overdoses. We have. You know, Amy mentioned, I think, 175 a day. That's a national number, but it affects us here in Orange County very much, because we have hundreds of people in Orange County dying from heroin and opioid overdoses all the time. Not to mention the greater number of people who overdose but recover because of Narcan or something like that, where they get some help. But that's one area. By the way, that's been quite a struggle, but I think at least it's growing on our side, because we started just, you know, with my office, the DA's office, and Santa Clara County County Council, and now we have 400 jurisdictions join the fight, and they're bringing these cases against these same companies, and we're pushing really hard for a trial date so we can get this resolved, which might be coming pretty soon. So we're working on that. But next up on this same problem that we're dealing with here is 25-year law enforcement veteran, Costa Mesa Police Chief Rob Sharpnack. And Rob's been the chief for 3 years, and he's done a tremendous job of adding more officers to the street, and he's a vital partner with my office, the DA's office, in many areas, including the Orange County Human Trafficking Task Force. So please, Chief.
Good evening. I just wanted to comment real quickly on the fentanyl proliferation that we're experiencing right now in law enforcement. 3 or 4 years ago, we watched as it started out on the East Coast and slowly but surely made its way all the way over here to the West Coast. And I can tell you, that is one deadly substance. An amount, I should say, the size of the tip of a pin is enough to kill a 250-pound man, whether it's through absorption or inhalation. It's gotten to the point where it's so bad, where law enforcement in Orange County are developing standards where we don't even test these substances. We send them right to the lab because of the inherent risks. So in order to help offset and prepare my officers, we are now going to equip all of our vehicles, police unit, patrol cars, with naloxone, which is a substance to help counter some of these, the effects and obviously the absorption of the fentanyl. In several cases, though, what we've seen, it takes dose after dose after dose to help offset these impacts. And so it's a small thing that we can do, but it's definitely something that we're going to have to continue to deal with through the short term and obviously into the long term. So we heard a lot about quality of life issues tonight as they revolve around sober living homes in our community here. And I can tell you, we certainly responded to our fair share of these issues, whether it's music complaints, code violations that initially we roll out to and then pass them on to our partners in code enforcement. But the bulk of our responses, the bulk of our issues that we're seeing are occurring throughout the community. And those are the crimes that are being perpetrated. These sober living home individuals that are coming are committing crimes that are decentralized to the given addresses that where they're residing in the homes. And so we're seeing folks that are coming from states as far away as New York, Virginia, Texas, and the like, and they wind up out on our streets. We see them rolling around with suitcases, waiting to get into the sober living home. Sometimes they don't make it to the sober living home. They fall off and they get involved with drugs or whatever their habit is, and they wind up into this circle, if you will, and wind up on the streets committing crimes. We also have folks who are in homes trying to battle their addiction, and somehow they get exposed to an individual who offers them up something, and they succumb, and they wind up out on the street again committing crimes. We've had those that have been curbed. We've heard that tonight, where they're actually kicked out of a sober living home for a rules violation, or if they fall back on their habit, they wind up out on the street, and we see them walking around. I have to tell you, in law enforcement, we are behind people that want to shed their addiction. We support those folks. However, we don't support people who want to come to our community, commit crimes, and degrade the quality of life for our citizens. That's where it stops. Recently, we've had cases throughout our city where we've responded to, and we've seen firsthand what the impacts are and how they're impacting quality of life in Costa Mesa. North end of town, we had 2 individuals. There was a resident who was away while their house was being worked on. They were doing some construction additions. Lo and behold, 2 folks, young adults, made their way into the house with their dog, and were actually living out of the house for a couple of days till an alert neighbor called us to report what was going on. We got actually out there on scene. We managed to capture them as they were trying to get away from the location, and lo and behold, they were from Ohio. They were here to recruit people from Ohio to our sober living homes. Just completely unacceptable. In another case, we had in the area a local bicycle shop owner, Electric Bikes. Those are pretty high-end bikes, and trying to do good as a steward in the community, he hired a sober living home to help him move his product inventory into the store. Quite a bit of bikes that were offloaded into his warehouse. That night, we responded out to a motion sensor in the business, and we realized quickly there was some activity going on in the store. People run out. Lo and behold, we found somebody had tunneled in through the top of the ceiling, parked a stolen box truck at the back of the business, and 26 of these electric bikes were loaded already into the truck, ready to go. So I could go on and on and on. You know, whether it's the meth-induced psychosis that we're seeing a lot of, we're seeing a lot of these impacts, you know, whether it relates to, you know, restaurants, bathrooms where we walk in and we find people with needles in their arms out. We had recently an individual on top of a roof who had gone through from a Midwestern state at that, and had gone through some issues at the sober living home, and was basically threatening to jump off the roof of a building until we were fortunately able to negotiate to the point where he was came down on his own and we took him into custody. So again, these are impacts that go on throughout the course of a given day, week, and month. It's difficult to track these individual incidents, and hopefully you know, we're making some implementations within our CAD-RMS system so that we could do a better job finding where we're at as far as the metric goes. How many are we responding? Where do we start? And what's our goal? And how do we help reduce these occurrences? You know, we do have a great partnership with DA Rakakis and the DA's office when it comes to human trafficking. And, you know, I can tell you, we have seen some cases where predators are preying on folks in sober living homes to introduce them into the sex trade. And in addition to that, I had one case, this was about 3 or 4 months ago, where a mother from Carmel, California emailed me, pleading with me to help her son who had fallen out of a sober living home. And initially when I read the email, it didn't seem right. It just, you know, it was just so odd to me. But what she relayed to me was that her son had fallen out of a sober living home and was being controlled by a dope dealer in the city. And you know, sometimes, you know, in our line we get a little bit of skepticism and think, well, you know, they're chasing their habit, or, you know, they're doing their thing, you know, on the street. But as we look more and more into it, we were able to locate the individual, and what was happening was we had a drug dealer in our city who was actually preying, and this wasn't the only individual, but preying on the sober living folks to get them to fall back on their habit, get them out on the street, and then ration them out enough drugs to get them to go to Target, to get them to go to Home Depot, and some of these other commercial centers and the like, to steal, so that they get the property and then fence the stolen property. And that goes on a lot. There's a big intricate network that we see. We try to do our best with undercover operations and the like, but this is something that we're seeing grow every single day. And so we're doing our best. As a community, I would welcome anybody, as I always do. You know, our phrase is, if you see something, say something. It was mentioned about the walkers, and we call them, you know, the folks that are walking through our neighborhoods at all hours of the night, looking for the easy opportunity, the easy score, you know, if you will. They're trying the door locks. They don't stop there, though. They're stopping and ringing doorbells, knocking on doors in the middle of the night to see if somebody's home. Then they walk around to see if there's a way that they can enter a residence. Last month in our crime analysis meeting, we looked at our thefts from vehicles, and I'll tell you, 60% of the crimes that we attributed thefts from vehicles were what we perceived to be unlocked vehicles. And so I believe that we need to do a better job as the police department in partnering with the community to get folks to understand that now the days are gone when we can leave our vehicles unlocked and secure, our residents unlocked and unsecure, or leave valuables out in sight, whether it's an iPhone, you know, a charging cable. Those things have to be kept out of view, because these are people who are desperate. They're looking for an easy score and an easy fix. And so in closing, we have a real problem here. I can't think of a better partner than the Orange County DA's office to get into this and roll up our sleeves and see what we can do toward reducing the impacts caused by these folks. And as DA Rakakis said, we have to do something now. We have to act now to stop this exploitation. Thank you.
And we have one more speaker, and that's Lori Durand of Advocates for Responsible Treatment. Lori.
Batting cleanup. My name is Lori Durand, and I'm with Advocates for Responsible Treatment, an all-volunteer citizens advocacy group working across Southern California to find win-wins for both recovering addicts and neighbors. We want to thank the District Attorney for holding this meeting. Up front, we have a message to everyone involved. When you think of stigma toward recovery, here's the worst. Letting people die and using the excuse that a recovering addict was going to die anyway. I was personally staggered when I read that quote. Here's our position. No one should die while under addiction treatment in California. If they're too sick to be handled in a house, they should be in a clinic or a hospital. If they are paying for supervision in a house, they should not be getting access to substances. No one leaves a toddler to fall into a swimming pool and then says, yeah, well, toddlers are just more likely to drown in swimming pools. Instead, we mandate fences and covers. To the operators, other than Nancy, who we especially thank for being here today, we are asked all the time, who are the good operators? It is not enough to say you are saving lives in your own programs. You are not succeeding if you have success with your own clients and stand by while other operators neglect and abuse people to death. You have to do more. Since November 1st, we have placed 19 complaints for illegal activities with the states. What are you doing to stop illegal activity? Fewer unscrupulous operators means more business for good operators. To the politicians, stop attending ribbon-cutting ceremonies. We don't need any more for-profit rehabs in Orange County. No one opening another rehab has a new or better solution or is now suddenly more committed. They only have a better scam. You don't want your name associated with an operator when the FBI comes or the DA is prosecuting. It's immoral for you to provide credibility, especially if it's going to be used to lure clients when you do not know how their businesses are operated or how they treat clients. So politicians, here's what else you can do to help recovering addicts, citizens, and cities legislatively. Number one, the state and city granted rights of recovering addicts need to be posted in every treatment center bathroom, along with hotlines to call for abuses and violations. It's unconscionable that a recovering addict who is being abused doesn't know their rights or whom to call. Number two, the state must license all business-operated houses that are providing care services like supervision, transportation, and meals to recovering addicts. Recovering addicts are considered disabled under the ADA. The state has an obligation to protect them and license their housing, just as it already licenses 26 other types of housing for protected classes in California. Number three, the state must eliminate Health Code Section 11834.23 and acknowledge that these houses are not families or a residential use of houses. Cities must be able to identify business-operated housing serving recovering addicts receiving care services. When a house catches on fire, and they do catch on fire, a young man died in a garage in Los Angeles last year, 3 women recently died in Tennessee, it's not just the lives of the people on the premises that are at risk. It's also our firefighters coming to a house expecting it to hold a couple of adults and a couple of kids when it has 12 or more adults. Overcrowding is hazardous to everyone's health. Number 4, if a business advertises a sober environment and supervision, addicts should not get access to illicit substances. We need stiff penalties for businesses not maintaining such environments. You know recovering addicts are prone to relapse. Stop blaming those in recovery. Number 5, in-house care staff and house managers in residences must have a minimum of EMT training. We want Narcan and a defibrillator in every house. Number 6, Instead of the 3 laws we have today, California needs 1 law that addresses all brokering, including internet advertising and out-of-state phone banks. It should make brokering a felony and level 5-figure fines that hurt for-profit operators charging tens of thousands of dollars a month. It should require operators, employees, and executives of the industry associations to be mandatory reporters. And if they don't report brokering, they should be charged as accessories. Number 7, California must end the LLC shell game. The state is doing nothing to prevent criminals from operating behind these facades. All owners and investors need to be publicly revealed. The state must hold them accountable with full liability. When a business is shut down or prosecuted, the owners and executives must be prohibited from owning or investing in a similar one. Number 8, I am a former licensed foster parent. All adults living in my house had to be fingerprinted, even my own children. The same employment standards that apply to boarding cares for the dozens of other classes of the disabled need to apply to services for recovering addicts. All owners, operators, employees, consultants, counselors, and therapists must be screened for crimes of predation, violence, drug distribution, and fraud. When our organization promotes fingerprinting, we often hear, but then felons won't be able to find work. This isn't the full felon employment industry. This is supposed to be the healthcare industry. Number 9, the Fair Housing Act does not cover those who endanger others. Residential solutions are not the answer for recovering addicts with predatory, abusive, violent, or distribution backgrounds who can and do endanger other recovering addicts with whom they are placed. Businesses must screen for these backgrounds and send dangerous people to non-residential facilities. Number 10, the Fair Housing Act, which is 50 years old this spring, was not intended to protect businesses operating transient housing in permanent residential neighborhoods. It was not intended to be weaponized by businesses against cities. It needs to be fixed. These 10 changes are just a start, but they'd be a good start. We have a 50-page footnoted document offering many other suggestions. Still, all the regulations in the world won't help us unless they're enforced. Government needs to provide more funding for investigators and prosecutors. Stop using the excuse that recovering addicts were going to die anyway. We're grateful that you came here tonight. Thank you for doing so. What will you do tomorrow?
Well, it's been a pretty long program, and I wanted to announce at least some of the people who were here who should be recognized. And so I'll say these are people who are either here or were here. And I could see well, Michael Baroni's here, and Michael is the past president of the Orange County Bar Association. He's general counsel now, Mike. The mayor of the city of Costa Mesa, Sandy Guinness, and she was a speaker. Thank you for being here, Sandy. Jim Righeimer, city councilman, Costa Mesa, and I think Jim might have left. Rob Sharpnack, police chief, Costa Mesa, thank you for being here. Carrie Ferguson, city council member, San Juan Capistrano. And I know Carrie was here. Oh, here she is. Okay, thank you. Deborah Lewis, council member, city of Dana Point. Now, you're not the mayor? Last year was mayor of Dana Point. All right. Vlad Mikulich, Office of the Insurance Commissioner, Dave Jones. Vlad Mikulich. Well, Carol Moore, mayor of the city of Laguna Woods. Are you still here, Carol? Still here, thank you. Joe Mueller, mayor pro tem, city of Dana Point. Katrina Foley, Costa Mesa City Council. Pardon me? Okay, sure, of course. But I just wanted to make that announcement. Paul Walters, Orange County District Attorney's Office, Investigative Bureau Chief and past president of the chief of the Santa Ana Police Department. And Alan Mansour, Costa Mesa City Council. Alan, I'm sure he must have had to leave. So we've been here for a while now, a couple of hours. So like I said, it's kind of a, you know, it's a pretty long meeting. And I still wanted to be able to try to take some of your questions. But before we do that, I'm sorry, we're going to get right to it. But before we do that, just want to say this certainly gives me an idea, and I know it gives some other people here quite an idea of the complexity and the depth of this problem. And it's a big societal problem that we have. And so, you know, what I intend to do on behalf of the DA's office is to put some resources into this. So I'm gonna establish a sober living accountability team, sober living home accountability team, and we'll be putting that together with the idea of going after these sober living homes and trying to clean this mess up to the extent that we can. It's huge, and you know, I can't promise complete success, but I think that we have some tools, and I think there's some things that we can do. One is we'll continue those criminal prosecutions without let up, and if we have to, we find more serious criminal conduct like that insurance fraud and that sort of thing, we're going to continue to go after that in as many cases as we can. But also, I think that we have some other tools besides that to be able to cover more cases, more of those homes faster, and that's and that's without making any legal changes or anything like that. But we do have some civil law, laws that allow us to bring cases against unfair business, cases for unfair business practices or false advertising and things of that nature. So we can do a little bit more of a widespread kind of investigation along that line with our unit, and we can bring those civil cases faster, I think, than criminal cases. I can't promise. I mean, there's really no such thing as great speed in court, but we will. I think we can cover a lot of places pretty quickly, and certainly at least get the word out that that we are here to hold people accountable. And another part that we're going to have to do, and very clear, we're going to need some legislation. So part of what we do, what we're going to have to do, is to have legislative proposals that will make a difference in this problem. And I can see that that there are a lot of possibilities in that regard. I mean, when we're in a situation here where you see all of these businesses being run out of homes, and this whole industry being unregulated, it seems to me like there's a lot that can be done. And I think that we're going to find a legislature that would be open to that. There was a suggestion about holding people responsible as felons for certain violations, and I'm not sure we can do that. This particular legislature or this particular administration, where we are right now in California, very, very difficult to have new felonies created. But we could try. We can certainly try. I mean, whenever I've tried in the last couple of years, they tell me that's dead on arrival. If it's a new felony, they don't want to hear about it. But that doesn't rule it out. As far as I'm concerned, things change, and the needs change. And I feel very confident about working together with a lot of partners. I've been talked to, I had an opportunity, we presented this to the chiefs of police, sheriff and chiefs of police meeting a couple of weeks ago, and we got a reception there that was inspiring in the sense of the enthusiasm of the various police chiefs and whose cities are so strongly affected by these problems, and they want to do what they can to try to assist. So I think we've got a pretty good chance of having a strong task force involved in here, not just the DA's office, but a multi-agency involving some others. And I know the insurance commission has already said they're going to work to help us with this. We work with the insurance commission all the time on a lot of things, particularly the insurance fraud stuff. And they have a whole investigative unit, and I think they can and are probably willing to put some resources into it. So, so we're going to make an effort to work to reduce this problem, to clean up to the extent that we can these sober living homes, and try to somehow reduce the tremendous damage that they're doing to our people in our neighborhoods. So with that, now I know that there were some questions. Nancy held herself out, so you might want to answer some questions. And yes, ma'am, way over there. Yes, yes, ma'am. Could you stand and maybe try to talk loud and state your name?
I have to tell you that I had a different, I thought this was very well done. I really enjoyed seeing all the many areas that are affected, but I have a problem, and maybe others do too. I don't have any idea how someone opens a home. Do you just get to say, tomorrow I'm opening one and I have my home? If that's the case, I like that answer. The second one is that someone indicated that the state comes and reviews. Well, what's the rule there? I have no idea what the state rule is. So my question is, how anyone can open a home if they choose, it appears. Two, if that's the case, the state comes and reviews. Why does the state come and review and they don't review over here? What's the rule there? I have no idea how this works. I see the problem, but I'm still very confused.
Well, the present circumstance is that that if they're gonna do treatment, if it's gonna be a treatment facility, then they're regulated by the state. If it's just a sober living home and they're not actually or don't put themselves out as engaging in treatment at the sober living home, then they're not required to have a license. So it's only the ones that have licenses that the state might inspect. And as you heard, the inspections, certainly in our county, are very few and far between, even on those. But right now, the state of the law is that pretty much just what you said, anybody can just move into a house and turn it into a sober living home. And there's some various laws that make it very difficult to regulate those, to zone them out of your place and so forth. But that's the kind of legislation we have to work on.
Can I ask one other one then? So it appears anyone can open a home at sober living. You obviously have to get a state license if you're giving treatment, and if you're giving that treatment, the state then will come and have some kind of test.
I said the state can, but they're not. They're not
okay,
doing
then the
it.
next, my third one, I'm sorry, drag you all through this, but I really don't have the details on this. Then, to meet insurance requirements, are there any standards whatsoever on that? I mean, that's where the money is apparently.
It is, and I'm not aware of any standards on that. They just bill the insurance companies. Yes, ma'am.
and they still turned it down. And so this is what we're finding. When we went to Washington, D.C., they all listened. It was all fine until we said, and you need to do something about it. Then they dragged out two things. One is they don't want us to limit access, and they continually push that up there. Well, limiting access by regulation. In other words, when the minute you say that you want to put a limit on what is happening in these homes, it's you're limiting access. So that is something that until we can get past that, we're going to have a very hard time having real change. And this goes for Senator Feinstein's office, who she personally has been the most helpful. But when you get down, you deal with her once, and then you're sent down to another person. When you get to another person, you're back at don't want to limit access. Then the second problem that we're up against is that they think it's just the rich coastal area, that no one else is suffering from this. However, the other thing that we're doing with ACCOC is that we're forming a coalition around the country. We're bringing more and more states into it because as there's more publicity, such as the wonderful articles that have been done in the Orange County Register, which are really outstanding, and more attention is drawn to the effects on our communities, but on the people that are in these homes. People are saying, well, yeah, that's happening in my state too. And so they're becoming more aware. And we're beginning to get the idea that it's a national problem. Until it's understood that it's a state problem and that it's a national problem, we're hamstrung.
We thank you very much, ma'am, for all of the things that you're doing. And we're going to start, and I understand, well, there might be some other people who want to ask some questions.
I'd like to ask a quick question.
All right.
This is important. Does anyone have a successful treatment model? Because obviously, as we heard tonight, there are a lot of not successful treatment models. So if you have one, come see me afterwards. I'd like to know that. Nancy Clark. Nancy Clark.
All right, we'll put you two together. Yes, sir.
George Ferguson, living in Yale. Just a couple of observations, no question. As a homeowner, you have no rights. As a facility operator, you have all the rights and the law on your side. The law is not on the homeowner's side. The work that you're doing, Lord, is God's work. Legislation's not going to do it because we've already said at the beginning of this meeting, we've got stopped in Sacramento, we've got stopped in Fullerton. I called Diane Feinstein, and they've never heard of this issue. And the city of Laguna Niguel, when I went to the city council meeting and we told them what was happening in our neighborhood, heard about it 5 hours ago, and the city administrator shrugged her shoulders at 120 homeowners. That's all I want to say.
Thank you, sir. And I'm not sure, what the legislation is exactly that we need, and but I'm sure that there is some. And I'm not ready to. I understand where you are, where you've been. I'm not ready to take that as the end because I want to, still try to get some legislation on this, and go ahead and put whatever pressure we can to get that done. And there was a question right here. Yes, ma'am. Yes. So I don't think that that you can guarantee an ordinance where the city's not going to be sued. I think you'll be sued. So what we need to do is come up. We've got some pretty good people thinking about this, and so we're gonna really work to try to come up with something that might make some difference. I mean, we'll see what we can do.
As a follow-up, I'm sorry. Is there a way then that the county could get a lot of cities, knowing we're gonna get sued, but everybody's here to do it because one little city can't just get squashed. But is there a way that the county can collectively have the cities agree, we're gonna do this all together, come up with at least a few ordinances, pass those across the county, Orange County, and just have like some sort of a fund to say, okay, we'll pool our efforts, we know we're gonna get sued, but let's really try to get down in there and fight and see if we can win something. I mean, is that?
Well, that's a good idea. We could maybe run that up the flagpole. I wouldn't be too optimistic about that. I mean, the county has, you know.
I wish Dana Point could be part of those cities.
I understand, but we're gonna make the effort to try to develop some kind of legislation, ordinance, or legislation from the state that allows the cities to do ordinances. So I promise we're gonna work on that. I can't promise the funding to help with the lawsuits. Of course. Well, let's come up with some kind of MOU for that. So. There's a question behind. Yes, ma'am.
Well, Costa Mesa does have an ordinance, but it's very difficult to enforce because the sober living, as Mayor Gaines will say, the sober living operators come in and they don't identify themselves. So that's the problem. But kudos to Nancy Clark. You set the bar really high. But I have a question because we've dealt with it here in Costa Mesa. What do you do when one, insurance runs out or there's a relapse that would happen? Because what happens here is when insurance runs out or there's a relapse, then those guys with the backpacks are on the street. What's the model that you use for those that have a relapse?
When somebody in our facility has a relapse, our licensing tells us that they have to leave the property, so they have to go to a detox. And so we find a detox that they can go to. We don't really have these high-end insurance policies, so it's not really an issue for us when insurance runs out because they don't come to us really with much insurance to speak of. So people have to pay cash. Our residents, after the first 30 days of intensive treatment, must find employment. They must find employment during the day and attend classes and groups in the evening. And they have to do that.
Well, thank you for setting the bar high, and I hope the Sober Living Network and all the other unregulated houses can somehow get the message from you on how to be a good neighbor. That's been the main problem.
It's just like recovery though. They have to want to be better.
Gentleman way in the back has had your hand up for quite a while, sir.
Costa Mesa resident, let me take a moment and say thank you for coming out tonight. But I've got a question. Where have you been for the last 8 years? This didn't start yesterday. This has been an epidemic in Costa Mesa for over 8 years. This isn't a photo op. I hear a lot of, we're going to try, we're going to try, we're going to try. I want to hear, we're going to do. Because if you can't do it, and you hold the office of the Attorney General, what are we going to do? The power is in your hand. They're not going to change what they're doing unless you force them to change what you're doing. What I haven't heard from most of these people is, these guys are bringing in $3,800 to $5,500 per bed. Some of the operators in Costa Mesa have up to 300 beds. You guys should figure out some math here. It's really simple. It's money. And they're buying politicians. They're buying people. An operator is making over $17 million a year in Costa Mesa. I'm sure you can find them probably on tax fraud. I don't know.
So, like I indicated, we've been working for a long time investigating insurance fraud, bringing cases against against the insurance frauds. And that's a labor-intensive, resource-rich problem. So, and you know, and I'm sorry if you're unhappy that I'm here tonight, and that I'm starting a task force and doing what we can to bring this together. But that's what I'm doing. So I can't go back into the past. Yes, ma'am, in the corner.
I want to thank you too for being here tonight. I'm also a resident of Costa Mesa, and one of the challenges in our city, and it sounds like it's universal, is people being informed and understanding the issue, not just locally, but in Sacramento and in Washington. What can this task force do to spread awareness, spread education to the legislatures and people who can assist in your task force goal? Because it seems there's a disconnect in understanding the problem and a disconnect in what the problem is. So before you can address it, you have to be able to articulate it and get that knowledge out there. This woman here, I think, was a mayor. Are you a mayor? She's a mayor. She didn't know how a sober living house opened. I know how a sober living house opens, and I'm a resident. No offense. We don't have any. Well, very good for you, but I'm thinking that city council members and mayors in Orange County should know this problem. They should know how a sober living house opens. They should know the regulations. They should know what ordinances are working, what cities are trying to put ordinances, or there needs to be informed individuals. Can you do that for us?
So part of what we're doing, and part of the plan, of course, is to work on awareness, to work on getting the word out, on developing the awareness so people do understand, and of course that's in part what we're doing here tonight. Yes, sir.
One of the questions I have from a victim standpoint, as Lori and I reach out, what we hear is, I've got this problem. Is there any way, is there a line, hotline, number, DA's office to call where they can talk, get somebody to give them information?
Yes, yes, and I think we have that. So the truth of the matter is yes, sir, we do have a hotline. We do have a hotline that we've created for this. We do have a hotline that we've created for this purpose, and it's 714-64-REACT, R-E-A-C-T, or the numbers 714-647-3228. 714-647-3228. That's for anybody who has information, tips, complaints. Yes, sir.
Tony, thanks for tonight. I'm Jeff Weiss. I'm in Costa Mesa. I'm excited as a resident of Costa Mesa resident because this is the problem. But I'm very happy that we got city staff in here that done just yeoman's work. I suggest that those of you that are from other cities that want to see an ordinance that we're trying to make work, we're fine-tuning it. Trafficking is fine-tuning it as we speak. Our staff really has done a great job trying to control this huge problem. It's a monster problem. Someone living homes enter a city and it's like quicksilver. You reach out and you grab them here, you squirt over there. You close down a someone living house here, and okay, that's done, but somebody else will open up that same house under a different name. So it's not an easy situation. But I think because we had to, because the Newport fought off their folks and just came up the hill and bought cheaper houses and started businesses. I think our staff, Tom Hatch and Parker Graziosi, the lawyer on this, have done a really good job
Thank you. Tracy?
I was going to say, Tracy from the DA's office. Tony is also coordinating with law enforcement across the county so that when there is calls for service at a sober living home and someone has died or overdosed, when we know about that, it wouldn't necessarily show up anywhere. The reports coming out of there will be centralized and we know where they are, because now we don't even know where they are. So that's another thing.
Yes, ma'am.
So I'm actually running for state assembly in this district, and I am hopeful and do believe that we can put together legislation that can actually help us address this problem across our communities. So my question is to you is what specific pieces of legislation at a state level would give your office what they need to actually go after these folks that are really exploiting some of the most vulnerable members of our community and destroying our communities in the process?
So we haven't developed that legislative proposal just yet. We're going to do that, and I've got some pretty good people to work on it. And we've got a lot of other partners here to help us with it, and I think we can see from tonight's event that there are a lot of very specific needs and some very specific ideas as to what needs to be done. Ladies and gentlemen, yes, one more.
A question for Chief Sharpneck, or perhaps you as well. Are we within our rights to take...
Stand up, Chief. You have to handle this one.
Answer is yes.
Are we within our rights to take pictures of things that are going on in the property next door to us that is questionable, or to be able to identify who's really there, who's running it, if they're, like pictures of their license plates of their cars, or weird things going on in the backyard that, they can see us?
Certainly you can, anytime you have public access to an individual or their property, etc., you can take a picture. However, we don't always recommend that, especially if they see you. You may elicit a violent reaction. It may cause retribution on you, your house, your family, etc. If you can go about it in a covert manner, then that may be of value to us if we go down the road, for example, on a nuisance abatement or something of that nature. So we typically tell people, if you feel something suspicious is going on, again, I'll reiterate this, call us, and so that we can come out and check it and let us do the fact-finding and reporting for the incident.
Thank you. And then one last question.
Yes.
Isn't there a zoning law that prohibits hotels to put their business in the middle of a neighborhood? And if so, how can these homes come in and actually rent rooms 20 days at a time, 30 days at a time? And
Right. That's exactly the issue that we're going to be working on. Basically, what you're talking about and what we have described is commercial businesses in a residential area. So and how to identify those and all of the things surrounding that. So that, I mean, you're absolutely right. That is a way for us to go. Thank you. Ladies and gentlemen, thank you so much for your time, your attention, and that's the